Good evening, all. For Nigeria, it's evening now. I don't that should be London time also. I'm speaking today on perennial flooding and its negative effect on health facilities and the community dwellers. Actually, just a preamble. By Nigeria, really, the almost, well, I say, two-thirds of Nigeria was highly flooded 2022 last year, precisely from October to November. But we enjoy it negatively and positively because I will speak out when when you're talking about enjoyment, so many factors come about it. We came out on it and apart from that, we enjoyed it fully. So let me go into the enjoyment part of it because we'll see every advent, every situation in life is always a point of trial and tribulations. People go through them. It's a scientific learning. And actually, some of us we learned, we grew on it. Some persons also we lost on some life. Now, the quickening of it, the quickening of its introduction. Flooding always results. Next slide, please. Flooding always result in a displacement of communities, dwellers, resulting in overcrowding in some environment. Sometimes it causes temporary crowding. Shelter is formed, what we call IDP camp is being formed, and also that some persons die in such conditions. Some persons don't even know how to swim. Migrants from different businessmen from different aspects of the country, mainly in the southeastern region, they don't know how to swim mainly. So they come to Bayelsa. Our area is mainly on mangrove, the mangrove, the rainforest zone. So it's just like it's a tradition. I could share that slide. It's a tradition for any person in Zoland, mainly the south. And when you are born, you dip into the water to learn how. After 7 days, they teach you how to swim. So after 7 days of birth, they teach you and dip you. Your mother must do that. It's like a ritual, those traditional ritual those days. But in vent of that, we come out with physical traumas. It comes, and in accident take place also. We have emotional displacement and overcrowding in some environment. You have visitors, apart from reptiles, visitors of sickness, and also some persons are coming from their homes, different immune system, are coming to your place without plan. You must accommodate persons. And as they're coming to your home, they are moving for your move. Flood will invade your environment. They move to another environment. Some people relocate. Almost a family, settled family, become visitors to about 7 homes. Flood enter this home. They go to another place. That's how they're moving. And they're picking infections, different area to another. Before you go to the next stage, you might come down cholera, typhoid fever, hepatitis B, scabies, and diarrhea might come up. Then we have almost all the flood in Bayelsa. We had 300 facilities, more than 300 facilities. All of them were submerged. Only level 1 tertiary inside the Federal Medical Center in the state capital was standing. Apart from those areas, those local governments were cut off. They were in high sea. With a place we call is at close to Atlantic Ocean. You have a shore. That local government, only 1 facility was there, and the headquarters had that. So flooding really, we have communication, we have contamination. We say it's a oil spillage in oil spill environment. So we have so many hazards normally take place in that place. Water is pumping into the oil well, hydrocarbon spill, and snakes swim freely into homes and water logs. Next slide, please. Then we have background really. In the background, I would just say we had about 500 IDP camps that was formed in the state. And those IDP camps, people were exposed to HIV, scabies, respiratory infection, and we have about 70 communities submerged in the water. You can see the way people were now living. Even our former president, President Jonathan Goodluck, was also submerged in his own hometown. He was living on top of Kenu before he now moved to Abuja. So the federal capital. The state recorded almost 1,000 drowned persons with multiple boat mishap. So it was just a pure disaster for the year. That is, I say, it was negative impact and positive impact on it. Then the about 50%, 500% had cholera and diarrhea outbreak in the IDP camp, and actually there was no vaccine. The vaccine could not. There was no way even vaccine to flee into the state. The airport was cut off. The road from other states was cut off. The 2 state area was now cut off from the other part of the world where the state was hanging value then. About 10 persons lost their life in that contaminated water during those drought, at least a little dry on the cholera outbreak. That is the time we now have, it is discovered then that they had cholera outbreak, vibrio cholera that can exist in salt water. In the early days of our research, we never had that research that vibrio cholera can exist in salt water. So that was then. Schools were shut down for about 3 months. Children, when I came out with KB, about 300, as I said it already, 300 facilities were submerged. Snake, we saw different type of snake that was floating everywhere, flowing just like that. And you'll be swimming, you'll be moving, before you leave your house to where there's the little hilly, you must move through a water that will be at the chest level. When there's no boat to take you to that. So you might jam snake. So people were moving, you see snake coming, you run back to your hideout. That's how it was. And 4 years village was everywhere, flowing. The water was contaminated. Those who had borehole and water stand was also submerged by these oils from the rigs. So it was just like people were not living. I say it's negative and positive impact. Now, impact required by partners and health care professionals. Next slide, please. Impact required by health professionals and partners on the negative impact of flooding on the vulnerable population. Vulnerable population, aged and underage. Even those have not the age, those ones who never learned how to swim, they're still vulnerable. Even those who know how to swim, it can also come down to different conditions. So we have operational research involving academias and CSOs. If persons come down, just like came from Paul and other speakers, knowing that we had increased bite rate of mosquito at that period. And apart from that, we have high level of snake bites, which are now flowing everywhere. Snakes were pushing, as the flood comes up, as the flood is entering people's house, people are evacuating. Snake is also coming along with high speed into those homes. And snake, by the end of early morning, before you come out your window side, if you manage to have a deck inside the house, mosquitoes are really piled on the windows like bees. So we are moving coughs at that moment. People were just treating to a point. We just let it be. So we have issue of provision of IEC material, advocacy, radio jingles. People should be ready. Early warning about it. Just like this time, this year there was no flood. This was on a natural standard of flood. It's not abnormal type of flood we want to see. Flood came, but people were able to manage themselves. It did not take up the communities this year. It was a natural way of flooding coming to a perennial level of flooding that came this year. So all of us, there was not too much cry. But at this stage, people don't know the status of NTDs in the state. That is the condition, because the last year, just like somebody spoke about soil being polluted by flood, then picking into the environment. At this stage, soil transmitted hermits, people don't know the status. And also the social stigmatization status, nobody knows now. Establishment of standard IDP camps across the state, having functional mobile clinic. At that time when they were IDP, they had only one mobile clinic that was in the form of boats, were floating to one place. Our ambulance could not move because there was no way for you to move. Only the state capitals has one road from Federal Medical Center that could move that. And those multiple IDP camps, those 500 IDP camps, more than that, were scattered all over. So you see that UNICEF were using plane, helicopter to go and drop the relief material in those places as if in form of mobile clinic then. And you know how expensive we could be costing an helicopter to land and distribute. In Naira form, it will be up to 1 million Naira or 500,000 Naira to move one movement of helicopter to push material to that point. So early warning will also help, and establishing standard clinic, mobile clinic in some of those environments, building them above water level, if there be a water level, because this last year came above all water projection on NEMA, SEMA standard was NEMA. I don't know if you understand, National Emergency Management Agency. So all of them were now the all projection was all SEMA, NEMA, national and state level. All information they gave was submerged by flood. Information on the flood could not stand all projections. So that is it. Timely evacuation of persons before and during the flood overflow, establishment of river ambulance. So at this stage, the state never suspected that last year flood, even Nigeria. So every person's, no person who had that believe that the flood could get to that level. In some places, it's up to 10 feet on a normal high level, 10 feet, non road level. So in the river level, in fact, just like sea overcoming everywhere. Because coming from River Niger, down from Sokoto, Aro, from northern side, and from River Benue, and also from Cameroon flood, the river, it flows into the side and now flows back to the Atlantic Ocean. You know, rotation of the moon have also effect on the Earth rotation has also effect on flooding. So that also that also had an effect in determining river ambulances and clinic, provision of cholera vaccine, and biodegradable water recycling system. No, somebody were talking about that. When you're doing about biodegradable water recycling system, you can recycle any type of water at any stage and make it portable. That would be another good project that we use to sustain flooded environment whereby they don't have any condition. You can have it very mobile water recycling. When I was in UK, we had that in Teesside. We had a project on that. And also training of health workers on emergency preparedness and vaccine uptake management. We have some persons, some health workers who are not really trained. Train or trainer is always there, but emergency preparedness is a recurrent material that health workers, when they are trained, they're able to manage even those mosquito repellent they were talking that used in Ghana. They're able to manage it during that period where the bite rate has increased. Because even this time when water log is there, you cannot determine the season and period of bite rate in a day again, because we have water logged everywhere, flooding release mosquitoes from every side. Even mosquito snake is almost vibrating everywhere now. If you have the best way to trap them in our place is using nets. Using nets, but mosquito fish trap nets, which you can also use in getting the snake trapped. But getting the trap using a net to trap mosquito, to trap snake should not be killed really. Under snake management, it should not be killed. It's a very big business in Chile and other countries. The venom is very, very rich. So the snake should be protected as far as you are also protecting your life. Next is next slide, please. The last slide. The last slide is now talking of provision of biodegradable snake repellent and anti-venom and venom in the facilities. There was a time we had venom. The first venom disclosed in Nigeria was gotten from a professor, a lecturer, NTD staff. He took a live snake into a briefcase, then to UK, tropical medicine at Liverpool, Institute for Tropical Medicine. Then, and also now that is where they will develop polyvenium vaccine that is now used for the snake management in Nigeria. At the present, the snake where I work in State Ministry of Health under NTDs, neglected tropical diseases, even in Federal Ministry of Health, we also we have snake bite under neglected tropical disease. There's no venom, there's no antivenom. We have market type monovalent. I will know the danger of administering a monovalent vaccine to a monovalent case. Then finally, if renal failure, kidney failure will involve. So such conditions, a standard snake venom, antivenom should be made available in such a facility, every facility, to curtail that during flooding, after flooding, the post-flood disaster surveillance and response. There should be a level of containment in surveillance. There's a passive and active surveillance system that's going to be in place to determine the level of outbreak. Different type of outbreak in different IDP may not be reported, but when there's a standard post flood disease surveillance and response, quick response and timely response and reporting, that would reduce the level of diseases, cholera outbreak, scabies, and even snake bites and reporting. We'll be able to know different type of snakes that are still surviving in different environments, because at this stage, the level of the type of snake which exists in places like Sokoto and Benue could also be finding itself in Bayelsa today, inside of the mangrove side now, because of the mingling of the last year flood. Even the status of schistosomiasis, even the soil status in the state along the Niger Delta region cannot be determined at this time without any mapping or surveillance or any research, operational research. Food security and nutrition. For food security and nutrition, one, if I that at that stage, even at the moment when the flood has come, storage material will not be there. There's not even facility to store the materials, to store any food, meaning that the food is wiping off. There's no food for even the poor, the public conditions, the vulnerable children, even the adults. Then the food security will always recycle, malnutrition will come in place. We need also some persons again. If you get to some places whereby you don't have such chance, no person to cater for them. The parents, maybe the children will be crying when the parents goes out to go and look for food, even under the flood. When they come back, the children can even walk out. There's a baby that walked out of the father's house when the father went to go and get food for the next island. Before he come back, the baby was also floating in the river, drowned already. Food security. There was flood, just flood. And that is the major, those are negative impact we had at that time of the flooding. In fact, the most of the island, most of the environment was cut off. Food security, people are still suffering on that level of food security because it's seasonal something. When you plant a cassava for this year and it takes up to 6, 7 months or 8 months to mature. Now, the flood receded from January last year. Now they are getting that. But this perennial flooding has come. People are warning that the perennial flood might be more than last year own. They went ahead and destroyed their food, thinking that the flood will come again. Now the flood will not come to that level. There's no food. Food security in danger. People are already having malnourished condition. Now, environmental management and pollution control. They've said about snake mosquito repellent is biodegradable, bio-friendly mosquito repellent. We should also go to mosquito snake biodegradable repellent that you can have around yourself, around your environment, that will not cause any havoc to your place. After every flooding, there's supposed to be pollution management control, fumigation in the homes, and if you biodegradable pollution material, it should not be benzene backbone layer. You should be to follow biodegradable and bio-friendly repellent and environmental management system, and routine mass administration of medicine for schisto and soil transmitted helminths. We saw about leishmaniasis. They're talking about other drugs, but those drugs, are they really friendly? What does the adverse effect? Are they be tested? Can it stand the test of time? Is it economical? Is it economically viable? Those are things we're now looking at. The NTDs, soil transmitted and schisto. They've tested schistosomiasis, praziquantel for schistosomiasis, and there are some countries where they don't have even finance or donor for pediatric schisto, praziquantel. That is the point. Now we're talking about leishmaniasis for pediatrics. What else can it stand the test of time in some countries where you don't have good funding capacity to stand those pediatric standard? If the donor is not there, sustainability comes. Which country can stand that level of sustainability? So we need to come out with a drug that has the standard that can be administered in every standard of the sickness of that disease. Schistosomiasis, yes, this drug, it can stand test of time. Be it upper layer, the lower layer, the children level, and the adult, pediatrics, and that. Soil transmitted, yes, we have that as mebendazole and albendazole. So you have pediatrics, and that is standing test of time. So for leishmaniasis, we should look at also if that pediatrics drug can also stand adult standard. If adults can they come into pellet or tablet form that could go for children and adults? So that those are areas we're now looking at. This routine mass administration of medicine. Less number of persons. In Nigeria, in Africa, before in Geneva, it was declared that we have level of volunteerism in Africa. But due to the economic standard now status, the level of volunteerism you can hear it by word. People don't tell you when you volunteer, say, yes, won't I survive? Won't I eat with my family? Somebody is volunteering. After volunteering, what are you keeping in mind to feed his family when he goes back to his home? That's level of going. So the spirit of volunteering in Africa, where they were standing before, is no more there to that point because of economic status of people. Those early days, people can feed themselves. They cannot have a leisure time to go and volunteer. Even in the UK, when we're there, we volunteer. You still have something to fall back to. But in Africa, yeah, the level of Africa, there's somebody to stand in that level of volunteering. Somebody in behind the screen who is there to sustain it, the volunteering point. So I can now sustain the point of somebody going to distribute those medicine freely and back. If somebody is not standing behind, or government is not standing behind, can they sustain that level of volunteerism? So coming in between, the outsiders, those who are helping people, should also be aware that this level of mass administration of medicine, treating the children in different form, are not much standing the test of time again. Even mass administration of medicine is standing, is helping, but it should be moderate. We should, outsiders, all of us should also be aware that the economic system is not friendly again to the world, even to people who are doing the volunteering. So with this, I want to say thank you for being part of my audience. Thank you.